Hope Channel, changing lives.
Welcome back. I want to say a big thank you to you for staying with us throughout this period. I want to say a big thank you to Anani Makun and the interview we just had. For those of us who've been with us for the past 6 weeks, we've been discussing about COVID-19, and today we'll continue our discussion. Our focus today is look at case management, how the patients are managed. We all know someone may test positive, the person is taken to the hospital, what goes in there from the time the person gets to the hospital to the time the person is discharged, or unfortunately the person passes out. So we have 2 key persons who are part of the nation's case management team to talk to us about what is going on. As we always say, if you have any question or contribution, you can send it to our WhatsApp number 0559 680066. 0559 680066. I'm going to introduce my 2 personalities and then we'll start the discussion. We have Dr. Ebenezer Joe Mensah. He is the family physician and also the medical superintendent for Ga East District Hospital. Doc, you're welcome.
Thank you.
How are you doing?
I'm doing well, thank you.
Thank God. And then we have Madam Evelyn Dowona. She's the nurse in charge at the treatment center at Ga East District Hospital. Madam Dowona, you're welcome.
Thank you.
I want you to talk to us briefly about Ga East. Many people have, if you remember when the case started coming up, Cape Coast, they were fighting against having an isolation center in Cape Coast in other areas. And you accepted to have your place as a treatment center. How does it feel like? And what goes on there?
Yeah, thank you, and good afternoon to our listeners. Yes, Ga East Municipal Hospital is located in Kwabenya. There's a 100-bed facility which was commissioned by the President, His Excellency Nana Dankwa Akufo-Addo, on 6th November.
Okay.
Yes, and we've undergone some trainings. The hospital was supposed to commence official clinical work in March.
Okay.
But then, somewhere February, we were alerted to the fact that we may have to provide some services for COVID-19.
Okay.
So the team of health personnel there began training late February into March, until eventually we had our first COVID-19 confirmed patient on the 21st of March.
Okay.
And since then, the entire hospital has been committed to managing COVID-19 patients.
Okay. So it means that the main idea for building a hospital was not for COVID-19 cases.
Not at all. It was for clinical work to serve the people of Kwabenya, let me say of Ga East municipality. Okay. But eventually ended up having to be used for COVID-19. Okay.
And how are the people taking it? They still live around Kwabenya?
Well, I'm sure initially they might not have been very happy about the idea of their first Ghana Health Service hospital being turned into a treatment center. But with the way things have gone in the country, I believe it was timely that the President commissioned the hospital around the time they did, so that such a facility was available immediately to help manage patients. Okay. So we haven't had too many issues since then.
Okay. Madam, how does it feel like working on patients who have COVID-19? Do you also face a stigma the patients face, or because of health workers, you don't go through all of these things?
No, we go through some of them. Initially, it was great working in the new facility. We were all happy. We got some few trainings, and it seems like most of my colleagues have taken in charge of most of the activities there. And all of a sudden, my boss said, this is what we use the facility for. Being an IPC coordinator, I was okay, because the only thing to beat the COVID-19 is adhering to IPC practices.
What IPC is?
And infection prevention and control.
Okay.
So as for the stigma, in fact, we have faced some. Okay, times when we even tell the patient to adhere to social distance, they feel like we are stigmatizing them, this kind of discriminating. We don't want them to come closer. We also go to town. That was last week. We went to town to get them some caps. And the woman saw, in fact, unintentionally, we went with our name tag. And she said, you are from the Gahis hospital. You people are managing the COVID. And she didn't want to sell the things like, you put your thing, the cap, no, we are now fine. That kind of thing. So we were like, oh, well, this thing too shall pass. So very soon, we know it will be over.
And we pray so. We pray so. What about your families? Are you having these two go home? Do you sleep them in the same bed, or you're having some RPC in their house?
For the past 6 weeks, I haven't been going to their house. I've been given an accommodation, courtesy my boss here. So I stayed in the accommodation and work over there. So we only do video calls, we talk and all that. But talking about going home, I think tomorrow there I will go home.
Well, just to add to that, we were lucky to have some accommodation on site. So for those who requested for accommodation, we provided some places for them to stay. Yes, and for those who needed to go home, well, our policy is to ensure that no staff member falls ill or gets infected with COVID, with the virus. So we've tried very much to adhere to strict infection prevention control measures. Yes, I always tell my staff, if you are afraid to go home because you infect your relatives, then you are not safe to work with us, because then you are likely to infect with the staff as well. So we try to maintain strict infection prevention control measures. But for those who do not want to go home, we provide place for them.
For them to leave.
Yes.
So let's try this. When the patients are brought by the ambulance or any other means of transport, what happens next? And this, we're talking about someone who has tested positive. The person has been brought to your place. What happens? How's the process like? We can go through the process and see.
Okay, let me start by saying that we, the doctors, coordinate the transport and translocation of the patients. So we get information from our colleagues within the communities that the patient has been tested positive, because our hospital only manages confirmed patients. Yes, and then we communicate with the National Ambulance Service. They bring the patient to us. Once the patient, so we are usually informed first, and we alert the nurses to the fact that a new patient is coming, so they can prepare. Once the patient gets into the facility, the nurses take over at that point, and that's where Evelyn will come in.
So the moment they arrive, the ambulance, there is a team called the disinfection, and then in that team we have the hygienist who plays the role of disinfecting the patients and their items. So once that is done, the next step is to move to the nurses station where we take their particulars.
Can we please look at what does it mean by disinfecting the patients?
Like spraying them with zero. Yes, they are 0.5% chlorine. Spray their bags and then
they get wet.
Not really. It's just the hands, the bags, and then the legs, kind of the feet and all that. Then they move to the nurses station where their vitals are taken. Where do you stay, any comorbidities, that kind of short questionnaire. Then from there, if you're a male, you'll be sent to the male ward. The nurse over there will put on the full personal protective equipment, then send you to your ward. In that ward, you'll be orientated in everything on the ward, where you are which washroom you are supposed to use, when are you supposed to come for your breakfast, the lunch, supper. Then you're also entitled to go to the staff lounge where there is a TV you can even watch, come out and then take some fresh air. But then social distancing is very important. So we do all those things for them. If anybody also has comorbidity, there is a team. That's we have critical care team, we have the pediatric nurse. In case you come with a baby, that pediatric nurse take care of that baby welfare. And then we have other categories of staff who manage the comorbidities very well. So it happens to the female as well. So this briefly, this is how we receive the patients to the ward.
So what about those who are not showing the symptoms? How do you put them in their rooms, or you mix them up with those who are not showing the symptoms?
So let me come in here. Let's talk about the organization of the treatment center. Some of our patients are asymptomatic or have very mild disease, just a slight fever, or will not show any symptoms. Some may come in with cough, sore throat, respiratory, a bit of respiratory symptoms. A few may come in breathless with breathing issues. Okay. Now we have areas for those with asymptomatic or mild disease. We have a separate area for those with symptoms, cough or respiratory, mild respiratory symptoms, or who have other comorbidities like diabetes, hypertension, etc. And then we have an intensive care unit as well. Yeah, so depending on what you present with, we either move you to the asymptomatic or mild area or to the emergency room where those with comorbidities are, or to the intensive care units. Each unit has its own staff of doctors and nurses on duty 24 hours. And that's how we organize them.
So then the other thing will be, for those who are not showing any symptom, what do you do for them as they come to the treatment center?
So again, the wards, have separate rooms. Usually shared as 2 to a room, 4 to a room, maximum 6 to a room.
The drug will be on for some time. Once they are as in the test and they come out with first test of negative, there is another room we move them to. If you test first negative, you don't stay in the same room with them, you move to a different room. And they will be there till they test the second negative, and then they can be discharged.
Yes, and just to add to that, if you are asymptomatic, that you come in without any symptoms. In Ghana, let me just indicate that there is no gold standard treatment of choice or cure yet. Several countries are trying several medicines, and in Ghana we have agreed to try a combination of hydroxychloroquine or chloroquine and azithromycin. But because of the availability, the asymptomatic ones are usually just put on azithromycin. They get their vitamin C. We make sure they eat well. They have a healthy diet: breakfast, lunch, supper, fruits. They exercise a lot. We have clinical psychologists, as you said, who review them. The doctors review them twice a day, morning and evening, to go through their symptom list with them, so that if you develop any symptoms, we're able to pick it early. For those with symptoms, we start them on hydroxychloroquine or chloroquine if they have comorbidities.
And so that answers the question that many people ask: if there's no treatment or no cure for COVID-19, how do we hear that people have recovered? I have over 130 people recovered, and it's based on what you just told us. Yes. The other thing will be those who are in severe cases. How do you manage them as well? And who will we call severe cases, and who will you call moderate cases? Because we usually hear that during the press conference. They say someone is severely ill or critically ill. How do you explain those ones?
So the virus, usually targets the respiratory system, especially the lower respiratory system. So most patients with moderate case, which we call moderate, have develop pneumonia. And it can progress into acute respiratory distress, into septic shock, and into respiratory failure. Those are the severe ones. For those who develop pneumonia, we usually manage them with antibiotics. But then we review them more critically. So the monitoring is more intense. And we move them into the emergency room. For those who require intensive care units, because as your respiration fails, we need to be intubated. They will move into the intensive care unit, and we have clinicians there. So we intubate them, and we keep monitoring them until they recover.
So, do you have anybody currently on ventilator, as we usually say, or now they are mild, as we say, Ghana case?
Currently, we have 3 patients in intensive care units. We've extubated one; he's doing well. The other 2 required oxygen therapy for a period, but they are all stable.
What accounts for we having more mild cases? Because when we watch the TV of other countries, and I saw one about Ekow, so disturbing, people that were dead on the streets, no place to bury them. What makes our case different from theirs?
I believe that a lot of the interventions government has put in has led to the reduction in the numbers.
Okay.
Yes, we can debate that we should have closed our borders early, but I still believe we did the right thing by closing the borders.
Okay.
So we managed to quickly isolate potential or suspected patients, okay, and eventually most of them ended up in Gais, okay, and those who tested positive. That we were able to reduce the chances of community spread.
Okay.
So we've managed to control the numbers. Let's be careful out there. What we see on TV are the severe cases requiring ICU care.
Okay.
Most of the patients are undergoing home care because their numbers are so huge that they've overwhelmed the healthcare services. We are lucky. We've managed to keep it under control to a large extent and keep the numbers low.
Okay.
But if we do not maintain social distancing, we do not reduce the spread by reducing shedding of the virus into the environment, onto surfaces, then we are going to see the numbers we are seeing in other countries.
Okay. Madam Evelyn, do you allow patient relatives to visit them whilst they are there, or nobody comes close to them?
Well, there is a security at the gate, and our protocol is if a family member or relative comes to visit, the person can call you on the phone,
Okay.
tell the person whatever you need. But if you come with items, the security officials will alert us. We go for it and disinfect and then hand over to the patient. You talk to the patient, but as in visiting the patient,
As it happens in our hospitals, it doesn't happen like
that. Initially we allow some of them, but they stand very far and talk to the patient. Let me say even 50 to 100 meters.
That's
to talk to them, see them shouting and all that. But it's for their own safety.
Yes, let me just add. We initially used to encourage relatives to come in and visit, especially for those who are just returned from outside the country. Okay, but then the perception out there, people do not understand the condition we're dealing with. So when they went back into the community and said, well, I've just visited Ekow Soama, then they now were considered contacts. But then really, by visiting did not mean you had direct interaction with the person. So there was always a distance. You stand quite a distance away from the person, and then you have whatever discussion you need to have. Okay. But we had to stop it because, again, the backlash wasn't the best. People did not understand what was going on and assumed that they have had direct physical contact with their relatives when they come there. That's how come we have to stop that.
Maybe I'll also add this. In case someone dies, what happens to the burial? Does a relative, the family come for you to bury? What is the protocol like for that?
Well, we unfortunately have had a number of deaths.
Okay.
Under such circumstances, the burial is handled by the government. Okay. So for the deaths we've had so far, it's buried by the state. We support the family to undertake the burial. We do not hand the body over to the family. So you make your arrangements for burial, you bring the coffin, and we support you to bury. We have identified a site for burial. If you have a site, it will be assessed by, we have the environmental team from the Accra Metropolitan Assembly. They will assess it and determine if it's the best place to undertake the burial, and then we'll support you. But we do not hand over the body to you.
But they can come around during the burial.
Yes, you can have a few people around.
And there's social distancing too.
Yes,
this is the 2 meters or the 100 meters.
Not the 100 meters, definitely 2 meters. Yes, but we do not let you handle the body.
Yes. Let me say this to our viewers that we'll be taking calls any moment from now. We want to ask Dr. Edwo Mensah and Madam Evelyn about how they manage the case. That's some of the questions that we've been having all this while. Now there are any question you have concerning how the patients are managed, can call us and then they can answer it for you. The number is 0302 959065. And then the WhatsApp number too is 0559 680066. All right. So just keep your WhatsApp messages coming and I'll read them to you. The other point what we want to look at is the recovery. We are initially we're having no recoveries at all, but sometimes now we start having recoveries. How do you declare someone recovered? And is it true recovery or paper recovery? So that you have to know. Yes.
Well, how do we first of all diagnose
Okay.
COVID-19? It's by laboratory testing. We take a nasal or oropharyngeal swab. We put a swab into your nose or mouth, or we take a sputum sample. We take it to the lab and then we run it, okay? And it tells us whether you are positive or not.
Okay.
So it's the same process. On the average, by the 14th day, some patients might start recovering
Okay.
up to day 21.
Okay.
So we usually do a repeat test 14 days after your first test.
Okay.
If you test negative at that time, we repeat the test after 24 hours.
Okay.
If you test negative again, that's a double negative, then you are deemed cured.
Okay.
Yes. If you test positive at day 14, we wait until day 21 to repeat the test again. And if you test negative this time around again, after 24 hours, we repeat the test.
Okay.
So if you are declared cured, it means that you've had 2 negative tests for COVID-19.
Okay. And it means that you can't infect any other person.
Well, that is what it means. That is what it means. Whether you yourself cannot be reinfected is the debate now. The question has been, what is the sensitivity of the test?
Okay.
Okay. And can you really be infected? Science tells us that you cannot be reinfected soon after you've been cured, because you still have antibodies in you to fight whatever virus comes in.
Okay.
There's been a few claims about people being infected. Whether it was because the initial test result was a false negative is something we are still looking at.
We are yet to look at. So if you discharge, how do you discharge? Does ambulance take them to their home, so we'll have their family come around and then take the person, then they're luggage? Do they go with the things they brought, like their bag, their towels, or they leave them there to be discarded?
So we always tell them, some of the things you bring to the ward on admissions, you don't take most of the things back. Some will be like maybe your normal sponge, the towels you use, and we don't encourage them to bring bowls or glasses or any sort of thing. What we are interested in is take away pack.
Okay.
When you finish eating, we want to, as much as possible, burn most of the things.
Okay.
So they only go with their bags and some few clothes they came with. But then, before you are discharged, you'll be cancelled. Then we give you some protocols to adhere while going home. Okay. The team will disinfect you, and then the ambulance will take you home. Then there are times when the number is very huge and they are going home. The national, the military bus will come around and convey them to their various destinations. Okay.
And is that not part of, and what is contributing to the stigmatization if the ambulance must bring the person from whoever knows this person is coming from the treatment center? Couldn't there have been any other arrangement?
Well, there's a condition that can spread very easily, so we need to be careful how they are handled.
Okay.
Yes. Even on discharge, when we tell you you are cured, we still advise that you stay in isolation for a minimum of 1 week before you start interacting with the general population. So it's important that we adhere to these guidelines. Why do we even stigmatize them in the first place? There's a pandemic everywhere in the world. It's being experienced. Presidents are falling ill with this. Ministers are dying. There's nothing to stigmatize somebody about when it comes to COVID-19.
Okay. One of the questions that comes is from Madam Clara Taylor. She says that she wants to inquire if a person who dies' body is infectious, the reason why the government want to bury. If is the dead body infectious?
Yes. Once you die, there's a virus. It's in the respiratory tract.
Yeah.
Okay. Studies are still ongoing, but it's always important that for a condition where there are many more unknowns than knowns, you treat the body cautiously.
Okay.
Yes. Ebola came, and we had similar issues with Ebola. A lot of other viral conditions have come in. So we are very cautious with how we handle such bodies. Okay. That is how come the government wants to supervise the burial.
Okay.
As I said earlier, we make sure the body is in a casket and then we supervise the burial. It does not necessarily mean we take the body and go and bury.
Okay.
We'll allow you to do what you need to do, but we'll supervise movement of the body, preparation of the body into a casket, and then we'll go and supervise the burial. Yes.
And now let's talk about the team, those who work in the treatment center. What kind of people work there? Because now I know that we have a barrier people, or sanitation guys, the environmentalists. What are other people who work in the treatment center?
We have the biomedical scientists.
Okay.
We have the laundry officers.
Okay.
We have the cleaners, like you said. Then we have the clinical psychologists. We have the health information officers. We have nurses from various backgrounds, like I mentioned. We have critical care nurses. We have pediatric nurses. We have midwives. We have general nurses.
Okay.
We have there's one more, perioperative in case of any surgery, because it's a hospital. So we have the perioperative, we have the anesthetics, etc. And then we have the administrative staff.
Okay.
Okay. Then again, we have the security to kind of protect us.
Okay. That means that it's like almost everybody works there.
It's a hospital. So the entire unit works, but we have different roles. The roles do overlap. So for example, when the team enters into a treatment center where the patient care area is, a doctor can play the role of a cleaner at that point.
Okay.
Again, you don't want to, you want to regulate the use of the personal protective equipment. You don't want to waste these things. They're expensive. Okay. So at any point in time, if let's say 2 persons enter the patient area, a doctor and a nurse, and a part of the room is untidy, you want to call a cleaner to come in and do that. The doctor and nurse will have to take care of that. Yes. So the roles overlap, but we definitely have our core roles, but we always overlap. We always support each other so that we can conserve the personal protective equipment and be efficient in the way we manage our patients.
So what will you tell a family member of a nurse or doctor who works in the treatment center?
That's a difficult one. Well, it's difficult. I have had issues myself with my partner, with my spouse and children, because initially they had difficulty accepting that I go in there and come back home.
Out.
Yeah, so it's difficult, but we need to also be supportive. These are healthcare personnel who are risking their own lives, okay, to prevent COVID-19 from coming to you in your homes, okay. So let's be supportive, let's be understanding. We need to encourage them to adhere to infection prevention and control measures. And whenever we go out there, we remember we have family back home. So we need to stay safe so that our family also stays safe. But our family also needs to be supportive of us.
Okay. So we'll be rounding up soon because we've had a lot of programs run. But Evelyn, can you please speak to us briefly about the IPCs, the hand washing and those things briefly, so we can, those of us who are at home can also learn something from that.
So,
and I see the masks. We can talk about the masks because we all have our masks here.
Yes. So I don't know. In fact, my advice is we need to wash our hands frequently, and then we should avoid touching our face. Okay. If you are going out, it's advisable to put on your face mask. Sure. Adhere to good cough etiquette. Okay. Then again, with regards to the PPE, in the facility is different, but out there, if you have your masks, if you have any sort of the mask, now we have masks with some kind of face shield, so you can also put down one on. Okay. And I like the fact that people are in town and they are all putting on face masks. People are washing. You go around and you see every shop has hand hygiene set, and I think it's the best way to go. Okay. So we should sustain it.
Okay. Okay. So take your last words, Dr. Drew, and then Madam Evelyn. And we'll bring our discussion to a close. Yes, please.
Yeah, thank you very much. COVID-19 is real. You meet people talking on the streets and it's like, oh, there's nothing going on. Until you get to a treatment center and see what's happening, then you realize it is real. We need to protect ourselves. Let's adhere to the President's directive. Social distancing is important, but most especially hand hygiene, and then wearing the face masks. The face mask helps us to prevent spreading the virus onto others.